Hello, my name is Camilla, and I'm a nurse practitioner. I specialize in pain management. If you have chronic pain, your doctor may recommend a therapy called neurostimulation. I'm here to provide a brief introduction to neurostimulation therapy and give you an idea of what you can expect from it. Neurostimulation involves an implantable pulse generator, also called an IPG, that generates mild electrical impulses that can interrupt your pain before it gets to your brain. The IPG is connected to thin wires, called leads, that deliver the electrical pulses to target nerves to block the pain. Both of these components are implanted in your body during a surgical procedure. One of the most advanced types of neurostimulation is called the Nalu Neurostimulation System. As you can see, the Nalu IPG is tiny, no bigger than the tip of my pinky finger. That's why they call it a micro IPG. Nalu can make their micro IPG that small because Nalu utilizes state-of-the-art microelectronics. Even though it's tiny, it's packed with very sophisticated electronics that represent an advancement in neurostimulation technology. And because it's so small, the Nalu Micro IPG only requires a minimally invasive surgical procedure to implant it. That means you have a tiny incision, which may help to reduce the likelihood of postoperative complications, such as pain and infection, and will probably be less visible under the skin than the larger IPGs. The Nalu Micro IPG is cleared in the United States by the FDA for 18 years, significantly longer than any other IPG. The reason the Nalu IPG is cleared for 18 years is because the battery is not inside the IPG like conventional systems. This means you will not have a battery inside your body. Because other systems have the battery inside, they are much bigger and require frequent surgical procedures to replace worn-out batteries. This can be as often as every 3 to 5 years. In the Nalu system, both the battery and the control system are contained in this therapy disc. The disc stays outside your body, while the micro IPG works inside your body to manage your pain. And because the battery is worn outside your body, the Nalu system eliminates the need for battery replacement surgeries and the associated costs and risks. You simply wear the therapy disc over the micro IPG in this adhesive clip. The adhesive clip is held in place by a medical-grade adhesive that is formulated to be friendly to the skin. You get 2 therapy discs with your system from the start. You wear one and keep the other one in a charger. When the battery you're wearing gets low, the therapy disc will beep and display a blinking light. You simply take it out of the clip and replace it with a fully charged disc, and then you get on with your life. With the Nalu Neurostimulation System, you will have the micro IPG implanted in your body, and it will be connected to leads that are placed near the nerves that are carrying pain signals to your brain. The micro IPG will send an electrical impulse in a specific pattern, called a program, through the leads to the target nerves to interrupt the pain signal. One type of program may work better for your pain than another type of program, so there are many different programs included in the Nalu system. Your doctor will help determine which programs work best for you. With the Nalu system, you will be able to turn stimulation on and off, control the intensity of the therapy, and even change programs using the Nalu app on your smartphone. And you can do this wherever you are without anybody else knowing you're doing it. The Nalu system can also be controlled with a therapy disc. To help determine if Nalu neurostimulation is going to help manage your pain, you can try the Nalu system on a temporary basis before you decide to go ahead with a permanent implant. First, you get to wear a therapy disc and adhesive clip for about a week to see what it feels like and where it is most comfortable for your particular pain. Once you are comfortable with the therapy disc, you move on to step 2. Here, you will find out if neurostimulation can help relieve your pain. The doctor will perform a small surgical procedure to place thin temporary wires, the leads, near the nerves most likely carrying the pain signal. Then, using a temporary external pulse generator, you will be able to try various programs and stimulation settings to see if your pain is reduced. If the first 2 steps are successful and you decide neurostimulation is a good solution for you, your doctor will place the Nalu Micro IPG and the permanent leads in the appropriate location for your pain. After a successful trial and with a permanent Nalu Neurostimulation System, you will hopefully be able to do many of the things you couldn't do when you had the pain. If this sounds like something you would like to consider, your doctor and staff are ready to get you on the path to relief.